Hi everyone, it's Dr. Elisha Van Dusen at New Hope Chiropractic again. Today I'm going to talk about differentiating low back pain from hip pain. Technically, the hip is the ball and socket joint between the long bone of your thigh and the pelvis. More often than not, many people will point to a number of different places on the back or pelvis and say, my hip's killing me. And in many cases, it's not the hip at all. Hip pain can be located in a variety of different places. It can be located in the front, in the groin area, the side, the back, or also in the buttocks. The classic sign of hip pain is reproduced most often when you try to cross your legs. Put your ankle on the far end of the thigh and then push down on your knee. So this may feel tight and cause pain in the groin area. For many people, hip pain is also reproduced when they cross their legs and then pull their knee towards the opposite shoulder. The hip is a very strong joint though, and it's strong because it's got a very deep receiving cup in the pelvis where the round ball of the femur or your leg bone fits into it. Because it's a freely moving joint, there is a joint capsule, and the capsule is lined with tissue that produces an oily substance called synovial fluid. It's a lubricant to the joint basically. And when hip pain occurs, this can be caused by capsulitis, which is inflammation of the capsule, and also a buildup of synovial fluid, which is synovitis. And when the smooth, shiny surface of the ball starts to wear thin, which can eventually wear down the bone as well, that's a condition called osteoarthritis. It's basically wear and tear of the joint. And this occurs over time for many people and can eventually result in the need for a hip replacement. So this is typically caused by trauma or micro trauma over many years. It can also be caused by the joint being subluxated or out of alignment, and that can cause uneven wear and tear, sort of like bad front end alignment on your car, causing the tires to wear unevenly. So hip replacements usually are not needed until an individual is in their late 60s or even older, if at all, hopefully not at all. But for, like I said before, those who injure their hip earlier in life, have some kind of a history of trauma, this wearing out process can accelerate, and you may actually need hip replacement at an earlier age because of that. But that's definitely not the norm. So there are many studies that report low back pain and hip arthritis often occur together, and differentiating between the two can definitely be a challenge sometimes. So just to give you an example, pain can radiate from the hip to the knee, which many doctors will diagnose as sciatic nerve problems, but hip pain can present exactly the same, making it hard to determine if it's low back generated or hip generated pain. So that's why it's so important for your chiropractic doctor to conduct a careful history and exam, for example. So, which is something we do at New Hope Chiropractic. There's specific tests that the chiropractor will do that'll help determine which is which, whether it's the low back or the hip that's causing it. And there are times when we may find that both problems coexist together, and that makes it necessary to treat two conditions rather than one. So there are a lot of ways to treat this. The first and most important is chiropractic adjustments. Very important to get the joint back in place so that it doesn't keep wearing prematurely and keep developing, so it doesn't continue to develop osteoarthritis. Mobilization is very important too. Get the joint moving again, and some soft tissue therapies may be necessary as well to work on the muscles and ligaments. And then exercises to stretch and strengthen are important too, for both hip pain and low back pain. So anyway, if you're not sure which is which, where your pain is coming from, whether it's from the low back or the hip, then come see us at New Hope Chiropractic, and we'll do a thorough consultation and examination and differentiate between the two, and then come up with a good course of treatment, good treatment plan to help correct the problem and get you moving and walking well again, get you on the road to good health. So check out our website, newhopechiropractic.com. You can always call us at 714-556-6966 and book an appointment. Hope you're having a great day.